Beyond the Headline, everyone, where we discuss the realities of launching, scaling, and investing in a business. I'm so excited to be here today with Kris Gale, the co-founder of Clover Health. Thank you for being here, Kris.
Yeah, absolutely. Thanks for having me.
Can we start out with you introducing us to the mentality at Clover that healthcare is not a transaction?
No, that's interesting. So, a lot of healthcare is run on sort of a transactional basis, and we think that leaves big opportunities to do the kinds of care interventions or follow-ups that can change the risk of somebody being, for example, admitted to the hospital or suffering an acute episode or a complication of a chronic disease. So the system, kind of as it stands in the conventional world, is such that you have symptoms, you have some sort of problem, you walk into a provider's office, you get treated in that moment, and if part of that is that you get diagnosed with a chronic disease, that provider will try to educate you about what's necessary for managing that chronic disease. So type 2 diabetes, for example, is something we really care about. But you're sort of sent off on your own largely to manage that disease. But if you look at the medical literature and you look at some pilot programs and studies that have been done, following up with people with chronic diseases using particular intervention approaches can produce a really meaningful reduction in the complications of those chronic diseases. But the problem is that fee-for-service or transactional medicine doesn't really create the financial incentive for providers to chase down certain follow-ups or fill gaps in care if they end up being left. So the whole Clover business model is built around the fact that we're an insurance payer, so we're on the hook for paying people's medical bills if they develop these complications. So we have a really high ROI for going out to fill these care gaps proactively. So that's really what we're looking at. We're not trying to replace anybody's doctors. We're not trying to replace the care they're getting, but we can sort of stand back and say, okay, given the care that we're observing that our members are receiving, do any opportunities exist for us to go out and provide services or follow-ups that our members aren't even asking for because we know they'll improve their health trajectory over time?
I think that's what really stood out to me, something you said before, that you're taking the time to improve their health outcomes. Can you give an example of how that works with the data and everything?
Yeah. So this is interesting, and this is why people ask me a lot of questions about why now or why don't the traditional payers do what Clover's doing. And part of it's that in order to do this effectively, you really need a modern business intelligence and data science stack to be able to figure out where the care gaps exist and prioritize them against each other. So essentially filling these care gaps, the way it works is we're taking all these raw data points that we have access to as an insurance company. So, medical claims actually already include some pretty good structured data. There's diagnoses that justify a given procedure or test. The procedures and tests are encoded into these CPT codes. So you can reason about all these raw data points. And then what we do is map them up through these concept ontologies to be able to say, this particular diagnosis is a type of chronic disease. This medication that this person is on is specifically an oral diabetes medication. This test result indicates that their diabetes is well controlled or poorly controlled. And then we can take those concepts then and map them to individual humans and say, okay, for example, this is a human being who may be a high-risk type 2 diabetic who has a comorbidity, a chronic condition they're also managing called congestive heart failure. And we can see that from all the raw data points we have mapped up through these ontologies. But then we can also maybe say, we have predictive models that say that there's a high probability chance that this person actually is dealing with depression and it hasn't been diagnosed. So we can schedule our team to go out and confirm that diagnosis or refer them to a health specialist who could make that diagnosis. And then from that concept of that person, with that state, that clinical state and that risk profile, we can say, okay, what would the appropriate standards of care for that person who we know those things about, what would the appropriate standards of care be? And then because we're the insurance company, we're actually paying when people go out and receive healthcare services. So now what we can do is compare those two things, the standard of care and the care they're actually observing, and say, where are the differences? What are the gaps? What are the things that are missing? And then we have a small team of nurse practitioners and social workers that go out to actually fill those gaps. And when we look across our whole population of members, we prioritize the care gaps that exist in terms of which are the most important for driving improved health outcomes. Who's going to benefit the most from having a particular care gap filled?
And I think what's most exciting, of course, the last statistic I saw is that it's 50% less hospital admissions and 34% less readmissions. That's got to feel pretty good.
Yeah, we've seen some good numbers so far. So just to caveat those numbers a little bit, those are based on the Medicare fee-for-service benchmarks for the first county that we're in. So these are people who would normally be on the government's traditional Medicare program, whereas on Clover they're receiving care management. There's potentially, some selection bias in those numbers. We're not ready to go out and publish those numbers in a journal study yet, but directionally, it's looking very good. I mean, we definitely know conclusively that this care management approach is improving health outcomes, and we can see that in a reduction in hospitalizations and hospital readmissions. So that's kind of what we're building the whole business around. Those cost savings for us then allow us to turn around and offer a health plan at a lower cost.
Absolutely, and I think that all of it lends to how intense of a technical problem you guys are solving and working with. And it stood out to me when Josh Kopelman over at First Round explained why they decided to veer from their traditional investment thesis to invest $4 million with you guys, because not only are you the team to do it, but as far as competitors, he compared it to GM trying to decide to go into search. What's your approach been diving into a very dense industry with completely new idea?
Yeah, no, it's interesting. We've had to find a bunch of domain experts who really understand how health insurance works and what motivates providers and what is clinically effective, and then sort of marry that with people who come from more of my background, from the software technology and startup world, where it's about what can we be empirical about, what can we be quantitative about, and how do we build testable hypotheses in small batches and iterate on them quickly. Whereas I think Josh's analogy with GM is really good, where if you were one of the big existing payers in this industry, you'd have to figure out not only how to solve all these problems, but how to convert 100,000 employee company to operate this way. We get to kind of start from scratch and say, okay, we're going to build this company around data feedback loops and iteration cycles and rapid hypothesis testing. But along the way, then be able to bring in expertise from the industry. So we're not inventing things that are known by professionals who've been working in healthcare for decades. We don't have to reinvent all those things from scratch. But we can test those things and sort of establish which things really work quantitatively.
I'm thrilled that you segued that way because it's a great introduction to your experience building the Clover team. You were just sharing that you guys are about 70 people now.
70 people here in San Francisco. So this office got started last July when I joined.
And you have a ton of experience launching and scaling engineering team. You were one of the first employees at Yammer, and you took the engineering team from 3 to over 200. What tactics have you taken from that experience to building your team at Clover?
Yeah, the big thing when you're scaling a team pretty rapidly, and it's funny, we're at like 70 people here. Yammer was, I think, 3 years in before we hit 70 people, or at least 70 people on the technology side. And we've done that in a year here. I'm so fortunate to have had the experience at Yammer and learn, and had the opportunity to learn over a longer time period. I mean, still Yammer's growth was pretty fast, but we had some time to try some things that didn't work. So the big thing or at least the big thing that I took away from Yammer was the importance of context and alignment, and bringing people along with the company's mission statement and understanding really what the high-level problem the company is trying to solve is. Because if you grow a company really fast, it's very easy to say, okay, I'm doing two things. I know I need to scale up, so I'm going to hire two people and say, you do the one thing and you do the other thing. And now I've scaled the company. The problem with that is like you're not giving them the context of why those things are being done. You're not giving them a framework for deciding to do completely different things. You haven't brought them along to do the mission. You've just delegated a bunch of tasks. So the big thing in scaling the company that I've really tried to focus on here is making sure that everyone who joins the company gets to sit down with me and hear my pitch of what is Clover, why does it exist, why are we different, what is the core thing that needs to work? In our case, it's outcomes improvements for anything else about the business to make any sense. And then give them a framework so that you can delegate entire business objectives to them. All the way down to entry-level positions across the organization, we do this because everything needs to add up to this collective thing we're trying to do.
And I think it lends back to a statement you've made previously that consistency and quality come from transparency and empowerment.
Yeah, no, absolutely.
And as far as that empowerment, it goes back to that context of understanding what the larger mission is. Can you give an example of maybe someone coming up with a new feature, how you relate that to the context, and then also complexity cost?
Oh yeah, wow. There's a lot. There's a lot in there. So what's interesting when you talk about the product here at Clover, I mean, our product is health insurance. Our product is health insurance that improves health outcomes. We're building a lot of software in order to be able to do that. But it's very important that everybody understand that, and this gets to your point, that the team that we're hiring is software product managers, or at least that's the background of the people we're bringing in. We need to make sure very early on that they realize they're not going to be measured on how well they built software. They're going to be measured on how well they contributed to the company's mission of improving health outcomes and keeping seniors out of the hospital. Because that's really what this means. So if that means for a software PM to come in and let's say we're building a clinical intervention protocol around behavioral health assessments, maybe the fastest way to do that isn't to build this beautiful piece of software for managing that process, but it's to get out in the field and understand, okay, what's actually going to work? So let's go out with a nurse practitioner, give permission to go on a home visit. Let's learn what their workflow looks like. And maybe they come away and then say, okay, we're going to build a minimum viable version of this particular program without involving the software engineers yet. I'll take a team of 2 nurse practitioners, do this with Google spreadsheets for a month and see what we learn, start to collect data, and then really understand, well, what needs to be built into the software. That saves us from, you were talking a little bit about complexity cost, that saves us from building things of speculative value, which end up just adding complexity to the software footprint that then need to be maintained over time. So it's really about start with the company's mission, do a version of that works, and then build just what's necessary to do that. And then let's move on to something else that helps to accelerate the company's mission.
I think that lends to the individuals that you're bringing on. You shared a great insight before that you want to work with egoless engineers. So it's not about showing off something fancy. It's about something that gets the job done.
Right. Yeah, no, that fits exactly into that. Whether it's engineers or clinicians or product managers, anyone in the organization, it's really about making sure we've all got our eyes on that thing we want to accomplish. And if there is a non-flashy, non-glamorous way to get there faster, we should be celebrating that as an organization and not celebrating things that demo well or things that seem technically impressive. I interview a lot of engineers who look at this and say, oh, this is a deep machine learning challenge. You need to figure out what care interventions to do at what time, and that probably takes this advanced approach and this approach. And it's like, no, actually maybe one of the most impactful things is just knowing who got out of the hospital today. Let's go see those people. That's like step one. So the health industry has so much missed opportunity in improving health outcomes that we don't need to do this really fancy, really technically complex stuff. We certainly will down the road. I mean, we don't ever want to stop optimizing. And once we've sort of harvested all the low-hanging fruit that exists, we'll need to get into those really, really deeply difficult technical challenges. But for now, we can see big inflections in people's health outcomes by doing things that are intuitive and just haven't been done by the industry or nobody's figured out how to do it at scale.
Glad that you mentioned the interview too, and it's something that you shared before, that everyone at Clover is so deeply tied to the mission? Because I mean, that was the first thing I told you. I wish that some members of my family had this. So everyone has that link. But how can you tell in an interview that that link is going to withstand?
Yeah, you know what's interesting? We listed in one of our very, very early investor pitch decks, like what are the risks to the business? How might this not work? And one of the things we actually called out as a bullet point was we might become a traditional insurance company. I mean, obviously, you can run a health insurance company under the traditional model and be successful. Companies have been doing it for decades. So it was really important to me to make sure that this idea of building an insurance company around improving health outcomes is so important to me personally that I want to make sure I surround myself with a staff that has that same emotional connection to the mission of the company. So it's a thing we actually actively screen for and talk about during the interview process and the evaluation process of candidates is, do they understand the mission? Are they bought into it? Do they care about it? Do they want that mission to succeed? And then in the millions of little decisions that are being made, everybody's saying, well, let's first try to do this by improving health outcomes, because that's going to be everybody's inclination and tendency. So I think that's one way to make sure that you stay on that path.
Something that lends to that path of really being so mission driven, as you guys have grown so quickly, the question that you shared, you were asking at Yammer, which was, a 3-year from 3 to 200 versus now, or 3 to 70, sorry, versus now you guys in a year are 70, was how do we scale engineering so that all problems get solved the same way they would have in the first year? As you guys deal with this massive growth, how are you ensuring that with a team now that's a year?
Yeah, no, absolutely. So one of the things that's super important to me is that I'm not just delegating a bunch of tasks to people, so that I'm not just taking the set of things I'm doing, hiring people and saying, okay, you can take this little chunk of what I'm doing and that'll be your job. But really to make sure that everybody owns a piece of the company's mission. So everybody, when they're hired from executive level positions down to entry level positions, gets an opportunity to sit down with me and have an hour-long conversation in a small group of just the people who've joined that week about what is the company's mission, why do we exist, what is the state of healthcare, what's the state of healthcare reform, what other things are being tried in the industry. So they really understand the differentiators for Clover, and they can make on-the-ground decisions that all sort of add up to our mission. And knowing that they have this context and that they understand the mission gives us the ability to delegate not just tasks but business objectives to people, to say, I'm going to trust your judgment here. You're clearly an expert in this domain that we've hired you to be an expert in. So now that you understand what we're trying to accomplish, you tell me what you should be doing every day. And that allows us to keep this speed up as we're scaling up the team.
I thought it was really beneficial when you shared that one of your core management philosophies right along that was never to stomp on autonomy. So if someone comes to you and says, well, you said that I was supposed to do this, you want them to, you're on the front line, you handle it.
Yeah.
For individuals who you're bringing on the team, who have maybe never worked in a culture like this, how do you infuse that to them?
Yeah, that's interesting. I think the big thing is making sure that people understand that what they're being held accountable to is a result and not doing a set of tasks. So it helps to say, look, here's what we're trying to accomplish. Here's the piece of it I think you can accomplish. So I'd love for you to look into this, come back with recommendations, figure out how we're going to solve this problem together. There's other people over here that will own this little part of it, and those two things need to overlap, so make sure you talk to that person. Yeah, no, absolutely. That's super important to me. I personally, one of the things I've done, since my background is all in software engineering, I was really sure that I was not going to write a single line of code in this particular business, because I knew that if it was going to have traction and be successful, it would have to scale up very quickly. And it's a thing I saw at Yammer, where I had built some of the early kind of core infrastructure that powered some pieces of Yammer and some other modules here and there. And what I found was that like 6 years later when I was leaving, there were pieces that had gone untouched because I ended up with this title, like VP of Engineering there, and people thought, oh, the VP of Engineering wrote this module. But that was 6 years ago when I knew much less than even I know now. And by the way, we hired you, and you're obviously a much better software engineer than I am. So why would you be using my title to So I wanted to make sure that I wasn't disempowering anyone through participation in those really early days. I thought that the thing that would have the most impact on the company's success was for me to go out and find a bunch of really talented people who could build that initial stuff for us. And that would empower them because I wouldn't have come in with my own preconceived notions about how they should attack those problems.
Exactly, and I think it goes into what you were just saying a couple minutes ago about, so you'll have one part of the problem, then someone else on the team will have that. And I know you're a big believer in the power of small groups. How is that translated to Clover?
Yeah, it's interesting. When you think of what happens in healthcare, not a lot happens in very short cycles. A lot is, we're going to try this new program this year, we're going to roll out this initiative, or we're going to pilot this. And these are things that will even take months to get to the point where a health system or a big payer or a government agency will even agree that this is a thing worth doing. So obviously they're not. The longer it takes to plan something, the more it grows in scope and complexity, because people say, oh, but also this, and what about this, and you should also consider this. So that ends up being a big project with a lot of people on it necessarily. And then it has all this overhead of project management and coordination. And if this whole thing doesn't deliver a giant impact, if it just delivers a small marginal benefit, it's going to be thrown away because the cost of implementing it was so high relative to the value it delivered. So part of the Clover hypothesis is that the effective care intervention protocols and programs and processes and things we do are going to be the cumulative result of a bunch of little things that add up and are really impactful together. But we don't want to say, okay, there's this small cohort of members who need this thing at this point in time. But that's going to be so hard to roll out an intervention protocol for that we'll never take it on. So it needs to be a forcing function of the organization that we keep the batch sizes really small of things we want to roll out so that they can be operationalized and tested and the hypotheses like confirmed or disconfirmed by a really small group of people, which means that those people also need to be empowered to make operational changes, code changes, data science changes. So this all kind of reinforces itself. When you push towards fast iteration in small batches, you get a lot of this stuff, and you force yourself organizationally to make sure everyone's aligned and empowered.
That note of just the transition and what it was like, is life different as a founder as it was when you were VP of Engineering?
Yes. Yeah, that's been one of the more surprising things for me is just how different it is. I mean, the amount of time that I have to spend out of the office, like doing interviews or talking to venture capitalists or to raise money, or out recruiting, trying to find executives to bring onto the team. It's just so much. Like I was in the habit of, okay, I know how to run a team. I'm getting better at this in my career. There's things I haven't figured out yet. I'm really eager to be in this position where I have to solve these problems. And then I find that for 60 to 75% of the week, my attention is facing outward. And that I think has been the most surprising transition for me. But what's great is that all these things I really enjoy doing, empowering people and giving them context and handing off strategic parts of the company or the mission to them is really the only way to succeed at doing this. So I get to do even more of that and be less on the hook for deliverables day by day. But it is definitely an adjustment.
When you think of the senior executives that you're just mentioning, that you're out hiring individuals to come take those roles, I've taken an interest in that lately because I had an aha moment where I was like, oh, there's not really a trial period for a senior
Right.
executive. How do you approach bringing on members of your leadership team?
Yeah, we've been pretty lucky so far that at least here in the technology office in San Francisco, most of the people in the leadership positions were individual contributors we had hired early on who had previous management and leadership experience. So that was a good thing where we didn't have to hire above people for those roles. But there's some roles where we just may eventually need to do that. So the conversations really, I think it's important to involve the people who are going to be reporting to those people in those conversations, because that's a big thing. Like you may find somebody who is qualified, is capable, but doesn't have the buy-in of the team, and they're not going to be successful. And that's the thing where, sometimes, like as a leader, you may decide that there's a reason you're bringing this person in, and it's because they see something that the team doesn't see, and you need to bring that insight or that perspective onto the team. So maybe that sets up a situation where the team is predisposed to not appreciate the value of this person. So that's like a major leadership challenge, and being able to communicate that. And it's part of the job to get good at that.
How do you get good at that?
I'm hoping to figure that out as it happens here. I think one of the big things is to make sure that people understand, people in individual contributor roles, people in what will become probably middle leadership roles, understand that the desire to bring on more senior experience shouldn't be seen as something that disempowers them or takes responsibility away from them, but as something that increases the odds that we as a company are going to succeed to a higher level that will ultimately open up bigger opportunities for them, not smaller ones. And getting people transition from that mentality, which I think a lot of us have, a lot of us who've worked at big companies especially, start with this mentality that, okay, the scope and size of the company is fixed. So in order to move up, I need to make sure nobody's getting above me in the org chart, and I'm getting above people in the org chart. But startups are fundamentally different. People come in with that baggage or with that preconceived notion that if I hire a boss for myself, that's going to shrink my role and shrink my responsibilities. But if the company's way down here, and you're hiring a boss for yourself that allows the company to get up here, then suddenly my scope and responsibility has gotten very large. But people need to trust you. They need to believe in the company's trajectory and the company's probability of success, and they need to believe you that by positioning it in this way that you can deliver on that if they're able to execute it increasingly, bigger scopes of responsibility.
I'm really glad that you mentioned that a lot of that has to do with them trusting you. Because you're just saying, 60 to 70% of your time now is spent outside of the office. So I imagine when you get into the office, you're thinking, oh my God, I just want to work. Sometimes I feel like if I'm out all day, I didn't even touch my to-do list. How do you make sure that you're making time to connect with everyone, that you know what people are up to, and you know their lives outside of Clover?
Yeah. I think it's really important to set up the cadences of meetings that are important for doing these things. I think advice I've heard over and over again, and I found to be true myself, is that things get really bad when, for example, your one-on-one schedule with your direct reports, when those get bumped, when you have to travel, or when you have to move things around to accommodate something that can't move. So in my case, sometimes it's investor pitches, sometimes it's meetings in other cities, where I end up falling off of my one-on-one schedule, and that always hurts. So it's a thing I'm personally working on right now, is trying to find a way to make sure that there are these dedicated times that people can count on, where they're getting one-on-one FaceTime with me as a manager, but then also with the organization as a whole. Really early on, one thing I think we have done pretty well is to set up a cadence of weekly team meetings that will happen. I think we've only missed 3 of them in a little over a year, just to make sure that you're always in a position where you can tell the narrative of, here's what we were trying to do, here's the progress we've made, here's what we need to do next, here's why it's important. And you can tell that story as it plays out week by week. I think is really important. And the only way to do it is to to have it as a block on the calendar that everybody understands is just always going to happen, except in the most extreme circumstances. And then also having those cadences of meetings with new employees. We're getting much more structured with our onboarding right now, so everybody's getting exposed to the same messages and context over time.
When it comes to those one-on-ones, the time with new individuals who are joining the team, and you reflect on that both at Clover and at Yammer, what have you learned about people and what makes them tick and feel appreciated?
Yeah, I think the thing I've learned, and this is maybe intuitive to people who have interacted with other humans more than they've thought about corporate hierarchy, is that people are really motivated by being a part of a mission and being aligned with something that's big, that a group of people are coming together to accomplish as a group, and to know that they have a piece of that mission being accomplished or not, or the degree to which you can achieve success in that mission. I think like a lot of the story we tell internally is about why we're here, why it's important, and why everybody is an important part of that. And I think that goes a long way to getting people to put time and energy and focus into the group's success collectively rather than just their own individual success.
I think that's really important, and I've always wondered how often, as a leader or someone who's a leader on the team, you have to be reinforcing the big mission.
I would say constantly. I think that one of the mistakes I've made in leadership in the past, and I to this day still have to remind myself over and over again, is the power of repetition. There's so many things that happen day to day that are potential distractions from the big core things that matter. And there are new people joining, especially in a high growth company. There are new people joining every day who didn't have exposure to you having said it in the past. So I think repeating this stuff constantly, and I think what's really important too is putting other people in a position to reinforce the message. Like putting people. So one of the things I've always thought was really important is when doing job interviews, that literally everyone in the company participates in job interviews. All of the software engineers are part of the pool of people who will interview a new software engineering candidate. It's not that everyone interviews with every current employee, but every current employee will do some portion of the load of interviewing people, in part because in that interview process, they have to represent the team's values, the team's priorities. They have to ask questions about what's it like to work here, why do you work here, why do you like to work here, and they have to develop habits around repeating those things to people and being able to not just repeat them, like parrot them, but to be able to represent them, to say, this is why it matters to me, this is my part of it, and to remind themselves that they are part of this larger thing and not just somebody who's writing lines of code.
And I think it lends to individuals and team members being more of a billboard for your company than any mantra you're going to write on the wall.
Yeah, and I think it's as much like having, it's nice to have more spokespeople out there. I mean, when you're growing a lot, you need referrals, you need people saying positive things about your company to their friends. But I think it's also important that they have a structured need to be thinking about that themselves. I think they're better at their jobs if they're thinking about how does this fit into the bigger picture, and being forced with confronting that question regularly.
Have you had a shift on the team where you had to go from an implicit culture that you had maybe when you were like 10 to 25 people, and then once you hit 50, where it changed and it no longer feels like a family sitting around dinner?
Yeah, and like I said, having gone from just a few people a year ago to 70 now in this office, and then we've got another large group in our Jersey City office, there's, you realize that you're not having the same scope of conversations. People's roles now are owning, they're able to specialize and like sort of focus on a smaller bit of the problem. So that just kind of necessarily changes the nature of some conversation. So you have to force yourself to create those situations and those environments in which people are talking outside of the stuff that's immediately adjacent to the work they're doing. So one of the things we do here, and this was something I borrowed from Yammer. This wasn't a program I put in place there, but a couple other engineers that I worked with, they would do a demo day every week, where on Thursdays we would just show the progress from the week. And what's nice about that for me is that running a health insurance company is complicated. There's so much surface area for health insurance. There's claims processing, there's our clinical intervention piece, there's the software engineering we're doing, there's provider relations, there's member outreach, there's sales. I mean, it's so much more complicated than a business like Yammer, an enterprise software business, or even a consumer software business. There's so much going in so many different directions. So demo day is a really nice, just stand up in front of a room of everyone and say, for 5 minutes, here's what I did this week, here's why it matters. It's an incremental step along this particular path, which is going to deliver this value. This overlaps your work in these ways. This is why it matters that we're doing this as a company. And again, it's one of those forcing functions that not only helps to share context with the larger group, but for the individuals who go up there and talk, it forces them to contextualize what they're doing in the bigger story of what we're accomplishing. So it helps them to make better prioritization decisions. So should I invest here or here? Well, let me think about why this is even important that I'm doing any of it. The other thing that I think is really cool about this, and we probably earlier than we needed to, bought a mixer and wireless microphones and a PA system for our big team meeting. Because we're right on the verge of you kind of had to yell a lot for everyone to be able to hear you. But also for me, I wanted to start building the habits of people doing like formal public speaking, like using a microphone, having discipline around that, having the presentation skills in a large group with those sorts of things and those sorts of distractions. Because the first few times you give a public talk where you have to worry about how close you are to the mic and where's the screen and all this stuff. But if we're going to build a company that competes at the scope of Humana or Aetna or United Healthcare, these are large companies with tens or hundreds of thousands of employees. We are going to be the leaders of that organization. So it's important to me that I'm building those skills in people so that they don't miss out on a major leadership role because we have to hire somebody who's slicker or more polished in these ways, or they're afraid of having to take a big stage and a role that involves having that stage.
That makes so much sense. I love that. And when you first started saying mics, I was like, oh God, do they do karaoke? Like, was that a big thing in the beginning? Before we go, Kris, just a couple more questions. Let's fast forward, and it's 5 years from now, 2020. There's a really big cover story coming out about Clover. What do you want the headline to be, and what do you want the picture to be?
Yeah, I don't know about the picture, but definitely the headline should be about how we have reduced costs for the government and improved health outcomes. I mean, that's what we're here to do.
Sounds like a plan. I'll buy lots of copies.
Awesome.
All right, and then the last three questions, and they're always just about life and more fun things. If you could teleport anywhere in the world, right? Actually, anywhere in the atmosphere, someone once said Mars. Where would you want to teleport to?
Let's see. Anywhere.
The Mars one threw me off.
Could it be a weekend, so I wouldn't feel like I was missing out on what I should be doing?
It could be a weekend.
Okay, I would be at a really awful, smelly dive bar with a band playing way too loud.
All right, good one. Question 2. If you could give everyone a fortune cookie with your favorite saying on it, what saying would you put inside?
Oh, yeah. This one's interesting. So this is kind of funny. It's a little bit tongue-in-cheek, but at Yammer, we really struggled with this idea that as we were solving these really hard problems, we were just facing harder problems, and it always felt like there was nothing but an unending stream of problems. So one of the things I would remind people, and it's totally tongue-in-cheek, but I would always say, winning feels like losing. Like, the fact that we're on a good trajectory isn't necessarily going to mean that it feels like there's always something wrong, there's always a new problem to solve. It always feels like things are going bad. But, if it felt like everything was going great, we would probably be missing something. We wouldn't be scaling, we wouldn't be growing. If you can get comfortable, you're not at a high growth startup. So I think my fortune cookie would say winning feels like losing.
I love it. I'm going to have to put that one on my mirror. That's a good one. It's a good reminder. Last one. What's one question that you've always wanted to be asked, personal, professional, athletic achievement from when you were 7 that nobody's ever asked you?
I don't think I've ever been the kind of person that like wanted to be on the spot with a question. I've never thought about that. Literally never thought about that. I'm going to have to spend some time thinking about that.
All right, well then I'll have to follow up.
Okay, that sounds good. I'll send you a note.
Sounds perfect. Kris, I can't thank you enough for taking the time. Before we go, can you share how everyone can learn more about what you're doing? And then team-wise, for someone who's interested in joining you guys, how can they do that?
Yeah, so cloverhealth.com is our main website. A lot of it's geared towards members who might want to sign up, but there is an about page. There's a jobs page that explains a little bit about what we're doing. We're starting an initiative right now also to put some blog posts together that kind of describe the actual challenges we're facing here. So if you follow the Clover Health account, Clover_Health, on Twitter, we'll be posting links to those blog posts as they come up. Yeah, I think that's it.
You got it covered. Thank you so much.